Dean, that's a fair point, isn't it?
Well, I think the reality is, though, you have to have a plan to fix these problems. And we've had not just the pandemic, but we've had to look at how we use technology into the future, which is a big passion of mine, how we help people live longer and have a better life through that. And I think this is about having a plan and having an action that's deliverable. And for many, many generations and for many governments, no one has solved this problem because it's been too big and too scary to deal with. We've got a government that actually will tackle the big problems, and we're going to get on and fix those problems.
Dean, this is the highest tax rate for 70 years. I'm not sure Margaret Thatcher would recognise this government as a Conservative government. It's a tax and spend government.
Well, no, I think if you look at where we would have been if the pandemic hadn't happened, that would definitely not be the case. I think that as a Conservative, for me, I want low taxes, I want a small state, support people through welfare where they need that support. But we're coming out of a global pandemic. And actually, if we're not prepared now to invest, to support people through not just the spending we've had, but also looking at the challenges we've got for health for the future, then we're in a real problem. One thing I would say is that, about 10, 12 years ago, when at the end of the Labour government, I remember doing a project looking at every NHS website as a part of a review. And I did the financial calculation, which showed that 87 to 121 million pounds a year were just being spent on websites. The investment that the Labour government will keep applauding didn't go to the right places. And so for now, we've got to make sure that we look not just at how we're putting money in, but how we look at effectiveness, about patient experience, patient outcomes, and make sure that we're doing this as a platform for the future for many generations to come.